Thanks for coming in for a cleaning today, Mrs. Parkinson. I'm so glad you did. I did some assessments in relation to your cleaning, and is it okay if I talk to you for a minute about some techniques and some things that can help you keep your teeth and the bone around them healthy?
Yeah.
Great. Okay. We talked about your diabetes, and I looked at your medical history, and diabetes was the thing that kind of stood out to me that may play a role in your oral health.
Okay.
So I wanted to talk to you about that a little bit. We did some other risk assessments, and I didn't really see anything that would contribute to your oral health, but the diabetes did stand out to me. We'll talk a little bit more about that.
Okay.
But I wanted to show you this chart for a minute, just to kind of explain things to you a little more. This is a really good representation of a healthy situation in the mouth around a tooth. You can see the tooth. You see the bone level. This is the bone that surrounds the tooth. You can see how high that is, right up to the top of that tooth.
Okay.
You can also see this pink that covers the bone right here. This is the gums. This is what you see when you look in your mouth, the pink.
Okay.
All right. In between the tooth and the gums, there is a little pocket area. You can see that little tiny pocket there. This instrument is called a probe, and you probably felt me in there probing around the teeth. All right. This probe has color changes every little bit. You can see those bands. Every color change is 3 millimeters.
Okay.
So a normal healthy pocket area is generally between 1 and 3 millimeters.
Okay.
You can see there's the gums are nice and pink, the bone's up here, so this is very healthy. Okay, so this is a different picture. You can see right here the gums are a little swollen and red. All right, and what happens is we get plaque down in this area. Have you heard the word plaque before?
Yeah.
Okay. Do you know what plaque is?
Maybe.
I know. Plaque is just bacteria.
Okay.
It's not food. A lot of people think it's food, but it's not. It is just bacteria.
Okay.
And what happens is you get plaque down in this little pocket area, and it causes an infection.
Okay.
And what the body does to try to get to take care of the plaque is it sends blood up to the area, and that's called gingivitis. The gums get swollen, they get puffy, there's increased blood. Okay, you might notice that when your gums bleed a little bit when you brush sometimes.
Yeah, they do.
Okay, and that's from the gingivitis. Okay, now and diabetes plays a role in this because the fluctuation of blood sugar, and especially having high blood sugar, what that does is it thickens the walls of those little capillaries there that the blood is in. And so the nutrients and the white blood cells that take care of the bacteria infection that is down in this pocket, they can't reach it as easily. And so that's how the blood sugar plays a role in this.
Oh, okay.
It kind of affects the response to it. It doesn't let your body do what it is capable because of the thickening of the walls of those blood vessels.
Okay.
So that's one way that your immune response isn't as strong when that blood sugar is
I didn't
high.
know that.
Yeah. Okay. And you'll notice also that the pocket depth has increased. You can see now that it's about 3 millimeters.
Yeah.
Because those gums are puffed up a little bit. Now the nice thing about gingivitis, it's completely reversible.
Oh.
All you have to do is clean this pocket area out, keep it clean, and within 2-3 days it will be gone, and it'll shrink back and be healthy again.
Perfect.
Notice the bone level is right where it was before.
Okay.
Okay, so there are some areas in your mouth that are in this state.
Okay.
Okay, but I want to show you. You've probably heard the word gum disease.
Yeah.
Okay, gum disease. Another word for it is periodontal disease.
Okay.
Okay, and this is what this picture is kind of showing, some early gum disease.
Okay.
And we'll talk about that. Okay, so now you can see this plaque. It's kind of a yellow. It's represented by that yellow right there. Plaque is very sticky. The consistency of it is like honey.
Okay.
So it takes time to remove, and it takes, you physically have to remove it off the tooth.
Okay.
But what happens is as that plaque is on the tooth for an extended period of time, for some people it's a day or two, that this can start happening. What happens is it starts to harden and become mineralized and stuck to the tooth.
Oh, okay.
And that's called tartar. You've probably heard that.
Yeah.
They talk about toothpaste and tartar.
Yeah.
Okay. Tartar is plaque that is hardened and stuck to the tooth. And that's why you're here today for a cleaning. So we can go in with our instruments and take that tartar off.
So I can't take the tartar off with my toothbrush?
No.
Okay.
You can take the plaque off when it's in the sticky plaque state. You can get this bacteria off your teeth. But when it's in the tartar state, then of course that's why you come here and we do it. Now tartar is not good because it creates a rough surface for more plaque to attach to, and then you get more plaque, and then it calcifies the tartar, and so round and round it goes.
Okay.
And so it's really important to break that cycle and to just keep that plaque off the tooth so it never becomes that tartar.
Okay.
Now the most important thing in this picture right here is right here. You can see what's happening to that bone. When bone becomes infected, it doesn't even stay around to try and fight it. It just simply dissolves away.
Okay.
Yeah. We talked about how you can see the gingivitis still, how that gingivitis is reversible. This is not reversible. That bone will never come back.
Oh, that's not good.
Yeah, it's not good. So for those reasons, preventing this is very, very important. You can also see now our probing depth is about 5 millimeters,
Yeah.
which creates more of a pocket for that plaque to get into.
Gotcha.
And the newest research with diabetes has shown that this type of infection also, interestingly enough, affects blood sugar. It can increase blood sugar.
For real?
Yes. So it's kind of a two-way street in that having a blood sugar that's too high can actually affect, fighting the plaque, which can in turn affect your blood sugar.
So if I don't keep my mouth clean, my blood sugars can go up.
Yes, it can have a direct effect on
I had
blood
no
sugar.
idea.
Right.
That's amazing.
So for all those reasons is very important. Now for you, it doesn't matter just because you do have diabetes, and that's a factor for you. That doesn't matter what you do, that this is going to happen. What it means is for you, it's more important to keep this plaque under control.
Okay.
For the overall health of your oral health and your overall health. Okay. I just want to show you down the road. You're not at this state yet, but I want to show you what can happen.
Okay.
And hopefully it won't, but what could. You can see now we have a situation with more plaque, more tartar, and our bone is here. Okay, our pocket's even deeper. And eventually, even at this stage, what will happen is you'll start to see that tooth be a little more mobile.
Oh.
Move back and forth.
Okay.
Which is not good for chewing, obviously.
Yeah.
And it's about this state that you will start to feel it too.
Okay.
That's the interesting thing about gum disease is you don't feel it until it's fairly advanced. And then it's sometimes too late to do anything.
Oh.
So,
So I could lose my teeth from this?
oh yes.
Okay.
Yeah. So for all these reasons, and then you can see that tooth is probably not very useful at all anymore. So okay. So I want to. You're doing a good job. You're brushing and flossing, and we've talked about that, and so that's wonderful. And we've reviewed some flossing, but I want to show you. I want to add an aid to the flossing.
Okay.
That I think will benefit you. I think the anatomy of your teeth in some spots, the floss might be missing a couple areas, and this will aid you in really getting in those spots.
Okay.
And I think it will help quite a bit. So I'm gonna show you that right now. Okay, so this is called a Perio Aid, and all it is simply is just a toothpick holder. Okay.
Okay.
But it's very, very efficient in removing plaque.
Okay.
Okay. So what you want to do is you want to get these toothpicks that are a little bit more like the restaurant type toothpicks.
Sure.
They have some kind of skinnier square ones you can purchase at the store that I wouldn't recommend for this.
Okay.
So I would get more of the thicker ones. You can get square or round.
Okay.
Round might work better just because the hole's round right there that you put it through.
Okay.
But I've used the square ones before. They work fine. So what you want to do is stick this through this hole right here, so it's pointing up at the ceiling, towards the ceiling.
Okay.
Okay. And then you want it about that far in, and then you just kind of turn this green little knob around.
Okay.
Then once it's fairly tight, break the end off. Okay. And you can use that for the next time.
Oh,
yeah.
okay.
So, and then you just want to maybe half a turn up or a full turn, one more, just to kind of tighten it.
Okay.
Now, this is a really neat thing because you can kind of bite on the tip of that, and it just splays that wood out and turns it into like a little microscopic brush.
Oh, cool.
And I really like that. And the
Okay.
other thing you could do with it, if you want to, is you could dip that in Listerine.
Ooh, that's very cool.
Yeah, and then it can get right down into that pocket area.
Okay.
Which is nice. Okay. So I'm going to hand this near to you, and I'm going to show you, and then I'm going to have you grab it and show me how to use it. Okay. So what you want to do, that pocket area we talked about is right down here. You can see that. So what you want to do is just take this and trace around the tooth. And once you're in between the teeth, you want to just kind of rub it up and down, right down in that pocket area. Now, if you want to make sure you're not hurting yourself, because if it's hurting, it means that you might be poking down into the gums just a little too far. So use that as your gauge to kind of know how you're doing that way. But you see how I just move that right in between and just scraping up and down. Then I move to the over to the other tooth, and notice how I'm pointing that down into the gums like this, instead of straight in like that.
Oh, okay.
Because if you point it down, then you can get right down in that little pocket area between the tooth, and right around like that. So in the back, I'll kind of show you. Same thing, you just trace right around in between, kind of scraping up and down, and then right around, and in between again, so kind of scraping up and down. And you'll get to the point where you learn your mouth so well with this, you can just sit down on the couch while you watch TV and kind of move it around.
Oh.
And it's kind of nice that way.
Yeah.
Like, so I'm going to have you hold that,
Okay.
and I'll hold that mirror for you.
Okay.
Okay, so you're doing okay, but you're trying to get up just a little higher, just up in that, see in the gums?
Oh.
So this area is fine to get to if you'd like to, but the main area where that plaque gets is right up. You see how that's pointed right up in the gums like that? So just make sure you're right where the tip of that just kind of disappears.
Oh, okay.
Up in the
So I
gums.
can go into the gums.
Oh
with
yes,
that.
you want to
Okay.
go into the gums with that.
Okay.
Oh yeah, that's better. Good. Oh yeah, good job. Okay, and then just make sure when you're in between that you're pointing that up and just really scraping right in between.
Okay.
Good. Good job. Okay. So I know you're already brushing and flossing like we talked about. I would like to add this to your home care. What would work for you, do you think, as a goal to adding this in? What do you think would work for you? You could.
Do you think I need to do it every day?
I think it would be really good to get in there 3 times a week with it.
Okay, I could do that.
Okay, it gets places I think that the floss might be missing.
Okay.
In between.
So could I use this one day and then the floss the next?
Oh, that would be a great plan.
Okay,
I think
I
that
can
would
do
work
that.
really well because then you're kind of getting all of the areas in different ways. So that would be a really good goal. Would that work
Yeah,
for you?
I can do that easily.
Oh, okay, wonderful. All right, thank you.
Thank you.